started, there are some Zoom housekeeping items that I'd like to go over. First, for all questions, please utilize the chat box or question and answer box that's located at the bottom of your screen. There are no continuing education credits provided during this webinar, and all our webinars will be available on the Hawaii Public Health Trading Pui's YouTube channel. So without further ado, I'd like to introduce you all to our presenters for today. First, we have Daintree Bartholdis. So Daintree serves as the Executive Director of Hawaii State Council on Developmental Disabilities, an agency which provides advocacy, capacity building, and systems change activities on behalf of persons with developmental disabilities. Daintree started with the council in 2012 as their community and legislative liaison, moving into the executive administrator position in 2018. So in 1999, she worked for the ARC in Hawaii, who played a key role in the closure of the state institution for individuals with intellectual and developmental disabilities. We also have with us Dr. Holly Manasari. So Dr. Manasari is an associate faculty member at the University of Hawaii Center on Disability Studies and serves as outreach coordinator and instructor in the Graduate Disability Studies program. She has over 30 years of experience working in K-12 schools and higher education, focused on teacher and school leader preparation for inclusive, accessible, caring school communities. Maya Mathis. Dr. Maya Mathis is a clinical psychologist and researcher at the Center on Disability Studies at UH Manoa. Her area of specialty is in intervention for autism spectrum disorder and other neurodevelopmental disorders. We are also joined by Benjalak Danduang, also known as Sai. And Sai is a graduate student at UH Manoa, and as a graduate assistant at CDS, she manages the vaccine access, social media content to increase access to information about COVID-19 vaccines in IWDS communities in Hawaii. We are also joined by two self-advocates, Ikaika Ka'ahanui and Bathe Fong. So Ikaika is a 17-year-old high school student with speech and hearing disabilities and is medically fragile. Earlier in life, he breathed through a tracheotomy tube. Ikaika has participated in 2 of the annual Hawaii Children and Youth Summit as a speaker and video producer. He advocated for increased opportunities to study the Hawaiian language and culture in public schools and also urged support for vaccination against COVID-19. He has produced a video that explains why he and his family chose to be vaccinated against COVID. So it takes immense courage and determination for a young person with a speech disability to speak publicly on multiple occasions. Ikaika provides a positive role model for youth with disabilities and demonstrates that all youth can overcome challenges to make a difference in their communities. And finally, we have with us Bathe Fong. Bathe is a person with a disability who uses a wheelchair and walker because of her health condition. She has learned to become an emergency preparedness trainer in the Feeling Safe, Being Safe program. She has been one of the co-authors of the All About Me booklet, which helps people with disabilities use their voice in meetings and teaches others how to run a meeting. She is currently the Hawaii Self-Advocacy Advisory Council President and a member of the Hawaii State Council on Developmental Disabilities. She also is an impact trainer with Tammy Irvard Consulting and was previously an employee with the Developmental Disability Division. Please join me in welcoming our speakers. I'll hand it off to Holly.
Aloha, everyone. I'm so happy to be joining you. I'm Holly Manasari at the Center on Disability Studies and the Outreach Coordinator at the Center. Next slide. About the Center on Disability Studies. CDS is an organized research unit housed within the College of Education at the University of Hawaii at Manoa. It is also a University Center for Excellence in Developmental Disabilities, or a UCED, authorized under the Developmental Disabilities Assistance and Bill of Rights Act of 2000. As one of the 67 UCEDs, it continues its commitment to support people with disabilities and their families through research, training, and demonstration activities, and disseminating the results of its work to community members, professionals, students, and policymakers. CDS is part of a tri-state agency with the Hawaii Developmental Disabilities Council and the Hawaii Disability Rights Center. As a valued partner with state and regional organizations, we respond to their needs for technical assistance. CDS designs and offers many training programs, provides community-based demonstrations, to build local capacity to improve services to individuals with disabilities, and conducts numerous statewide, national, and international dissemination activities. The COVID-19 Vaccine Access Project at CDS is part of a national effort to ensure that everyone is able to make an informed decision about receiving the COVID-19 vaccine. It aims to ensure that information about the vaccine is available in accessible formats, including plain language, ASL, Olelo Hawaii, and others that are needed in our community. The project also aims to increase access to the vaccination for people with disabilities and other underserved populations by arranging transportation and community access sites. Next. During the COVID-19 pandemic, nearly all projects funded by the Administration for Community Living, or the ACL, experienced substantial delays and required pivoting in some way during the pandemic. Grantees used this opportunity to collect data on the experiences of people with disabilities. A recent report by the ACL summarizes some of these findings, noting that people with disabilities were disproportionately affected by the hardships of COVID-19, and some groups of people have been particularly hard hit, such as the disadvantages that people with disabilities experience in healthcare and community living place them at greater risk for poor COVID-19 outcomes. Adults with physical disabilities from marginalized communities, such as disabled older adults, non-Hispanic Black and Hispanic disabled individuals, as well as disabled residents of homeless shelters, were overrepresented among US COVID-19 patients requiring hospitalization. Also, individuals with mobility impairments found that access to family and friends was most negatively affected topic related to participation, followed by concerns over access to food and groceries, transportation, employment, the ability to continue to live independently, caring for others, and participating in the community in general. We will make the full report available to you as part of our resources at the end of this webinar. It has been our pleasure to do this work through partnership and outreach, and I'd like to highlight our collaboration with partners in 3 key areas. The first has been joining with community agencies during their vaccine clinic events. We have worked with the Boys and Girls Club of Nanakuli and Waianae, as well as Hauula Community Center on the North Shore, to provide outreach directly to individuals with disabilities and their families and caregivers by promoting these events with our tri-agency partners. We have also provided resources and information directly at the clinic, and we're able to collect feedback on the experiences of individuals with disabilities in getting access to the vaccination. We also developed sensory kits that were shared at the clinic sites to address vaccine hesitancy. And Maya will be sharing more about that later on in the webinar. And this fall, we continued this work with Philcom Cares, who has been continuing to host vaccination clinics, helping us to expand our reach to individuals with disabilities in the communities that they have been serving. The second area of partnership has been with the Bay Clinic on Hawaii Island. Our work here focused on outreach in preschools and with school-aged children with disabilities, focusing on the key message to play safe during summer fun. This was really important as they were about to engage in more social activities and as mask mandates were expiring. With our work and partnership with the Bay Clinic, we provided keiki masks, test kits, informational flyers for families about vaccination, and hand sanitizer bottles that could be refillable. Through this partnership, we were really blown away. We were able to reach over 3,000 families. Our test kit and mask distribution has been a large part of our focus, also extending into the Pacific region. We have shipped over 1,500 test kits and masks through our affiliation with our Pacific Basin University Center for Excellence in Developmental Disabilities. And at this time, I'd like to turn this over to my colleague, Maya, who will introduce herself and share more about our sensory kits, our development of adaptive test kits, and the technical assistance video that has been produced to ensure accurate use of the adapted test kit items.
Aloha, everyone. My name is Maya. I'm a faculty member at the Center on Disability Studies. I'm going to be introducing a few of the projects that we have developed to meet the identified needs of people with disabilities. One of the projects I helped develop was a video describing 5 tips for helping both children and adults with developmental disabilities in receiving the COVID-19 vaccine. Many people with developmental disabilities have experienced medical trauma and have fears surrounding doctors' offices as well as injections. These tips are aimed at parents and caregivers as well as vaccination providers. Let's take a look. Getting the COVID-19 vaccine, 5 tips for helping children and adults with developmental disabilities. Presented by the Center on Disability Studies at the University of Hawai, Manoa. People with developmental disabilities may have difficulty with vaccinations for a number of reasons, including sensory needs, fear of needles, fear of medical providers, and difficulty with new situations. Here are 5 tips from the experts to help caregivers and vaccination providers make it easier for children and adults with developmental disabilities. Tip number 1, have soothing items available before, during, and after the shot. Encourage children and adults with developmental disabilities to select items to bring with them to help them feel safe and brave. These could be things like security items, a favorite toy, or a sensory item like a stress ball or fidget spinner. Tip number 2, create a more sensory-friendly environment. Some ways to do this are by reducing bright overhead lights, creating a private space for vaccine administration. Curtains or space partitions work well if you don't have access to a separate room. And providing sensory-based distractions such as fidget toys, headphones for noise blocking or with music, and videos. Tip number 3, offer choices. Offering choices is an easy way to help people feel empowered and part of the process. Offer a few simple choices throughout the visit. Some examples are, which arm should we choose? Do you want to hold a popper toy or a squishy ball? Which Band-Aid would you like me to put on afterward? Tip number 4, social stories. Social stories are a learning tool that helps people learn about what to expect in new situations. A social story about getting a COVID-19 shot might walk you through each of the steps from arriving at the vaccination location, waiting for your turn, receiving the shot, and waiting 15 minutes afterwards. There are a number of pre-made social stories available, both as printables and videos. We have some on our resource page for you to check out. Social stories work best when a caregiver introduces the story in advance of the event. Go through the story multiple times when the individual is nervous, and also encourage them to refer to the story on their own. When you are at the vaccination visit, refer to the social story and talk through each step in the process together. Tip number 5, rewards. Rewards can be powerful incentives and can help with scary and difficult situations. To make the reward as effective as possible, talk with the individual in advance about the reward and offer them a few choices to pick from. Keep in mind that the reward doesn't need to be fancy or expensive. It can be simple, like a fun activity or a sweet treat. Remind the individual about the reward before and during the vaccination process. Make sure they get the reward immediately afterwards and praise them for being very patient and brave. Good luck! We hope these tips are helpful. Remember that receiving a vaccination can be a very scary and stressful process for people with developmental disabilities. However, with a few simple adjustments, the process can be easier for everyone. We hope this is helpful. We also have more resources on the COVID-19 vaccination on our website.
Created using Powtoon.
Getting the COVID-19. So building off the simple tips, we also put together sensory kits. These were distributed at our vaccination clinics and through community partners such as the Bay Clinic and Philcom Cares. The kits included things like a fidget toy, earplugs, fun Band-Aids, hand sanitizing wipes, reward stickers, KN95 masks, and a social story. Here's the handout that came with our sensory kit aimed at parents and caregivers of young children. So we have tips and tools, as well as a social story for children about the vaccination experience. Let's take a closer look at the tips and tools. The tips are very similar to those discussed in the video, using the social story to help the child know what to expect, using a fidget toy and comfort items to manage the sensory environment, staying positive and using praise, and using rewards such as a fun Band-Aid and sticker. There's also a first then visual tool that can help communicate with children who may struggle with receptive communication. And here's the social story that we developed for children. As you can see, it walks through each step of the process. It uses plain language and colorful, fun graphics. Here's another adult social story that we developed that was aimed towards adults. And you can see the language you use is plain, and the images and colors are accurate, but not as childish or colorful. Another project that we developed for dissemination was the adaptive equipment kits. These are kits of items that can help people with disabilities, as well as Kapuna, more easily use a rapid home COVID-19 test kit. If you've taken one of these tests before, you know how complex the directions can be, as well as how small some of the components are, making them difficult to handle. We produced a short video that provides technical assistance in using these kits and using a rapid home test along with self-advocate volunteers. Let's take a look at this video. It's not a very flattering pause. Hold on. Aloha, my name is Maya, and
I share the screen. I try to share the screen while playing a video. Something else.
yeah, the video isn't working. Let me just skip ahead in the presentation. Sorry about that. So we do have some additional resources that we would like to talk about. And for this section, I'm going to hand it over to our graduate assistant, Sai.
Aloha everyone, I'm Sai, and as Maya said, I'm a graduate assistant here at CDS. I'm going to go briefly through our COVID online resources, including website and Instagram. Maya, can you go to the next slide, please? To show you how the website looks like. So our website is a more formal communication channel that compiles resources that viewers can download. And we also have links to the CDS resources in multiple languages, as well as other external resources. So you can follow the link, in the previous slide, but you can go through that later if you want. And for this slide, just go through the, Instagram. Our next website is Instagram, and this is a more informal and more frequently updated site. So from our first post since January 19 this year up until now, we have 53 posts with 193 followers. We usually post that once or twice a week. What we covered includes news updates, guidelines, resources in non-English languages, summary of articles we found interesting, our program activities, as well as our partners' activities. Next slide, please. And can you go, just click on the link to show, this is an example of how we try to cater to differently abled and multilingual audiences. This is an American Sign Language post, and he's signing what to do if you are sick. Next slide. This is another post. Next, please. This is another post on multilingual resources. We try to make this colorful and appealing to the eyes. Next, please. This is a summary of COVID-19 related articles. This one is on myth and fact. So we hope this can bring better understanding of vaccines. Next, please. This is local news and topics like mask mandate update. Next, please. This one is on plain language. This one is a plain language summary of an article that I found about COVID that I think could be useful for the audience. Next, please. Next, please. And this one, we also target audience who work with an individual with disabilities by providing some tips on communication. And next slide will show that we also have plain language tips, how to use them. And next slide. I think next slide. Oh, okay, ran out of examples. But that's what we've been doing so far, and I encourage you to check out these two websites. Mahalo.
Thanks, Sai. So I'm just going to pull up the video that I wasn't able to get working on YouTube and play it in a different format. So just give me a second while I transition over. Aloha, my name is Maya, and I'm with the Center on Disability Studies with the University of Hawaii. This video is to show you how to use our adaptive equipment kit to take a rapid home COVID-19 test. This kit will help you take this test because it has a lot of fiddly small parts. So this is going to help anyone who has fine motor difficulties, such as kapuna or people with disabilities. This kit is available for free. If you would like to request a kit, you can email us at cdsinfo@hawaii.edu. This kit has several different items, including a timer, a binder clip, a colorful clip, tissues, a highlighter, a bookmark that is a magnifying glass and a ruler, a hand sanitizing wipe, and a lollipop. This adaptive equipment kit is designed to be used with any home rapid COVID-19 test. There are many different brands of tests available, and they all have different instructions, so make sure that you follow the instructions that came with your test kit. Okay, now I'm going to do a demonstration of how to use the adaptive kit with your home test kit. The kit that I have is from FlowFlex. Before you open the box, the first thing that you should do is check the expiration date to make sure that the test is still good to use. The first step is to read the instructions that came with your test kit. As a reminder, please follow the instructions that came with your test kit as they all vary between brands. Your adaptive kit has a bookmark with a magnifying glass. You can use this to more easily read the text since it's pretty small. After you read your instructions, check your test kit to make sure that you have all of the contents. It helps to lay everything out on the table in front of you. Okay. The next step is to clean your hands. We're going to use the hand sanitizing wipe, but you can also wash your hands with soap and water. Make sure that your hands are clean. We're going to wash them thoroughly with the wipe. make sure your hands are dry before moving on. Okay, great. Now we're ready for the test tube. Remember to read the instructions for your test kit. This test kit has a hole in the box that you can use as a stand for your tube. However, not all test kits have that. You can also use the binder clip that came in your adaptive equipment kit. We're going to use the binder clip to stand the tube upright. Next, we're going to prepare the swab. The first thing that you can do is take a tissue out of your pack and lay it on the table so we have a clean place to put the swab if we need to put it down. Okay, next we're going to open the swab. The swab looks a little bit like a long Q-tip with a cotton part on top and a long stick. Make sure that when you're handling the swab to only touch the stick and leave the cotton part untouched. Okay, you can use the colorful clip to more easily hold the swab. Clip it in the middle. This creates a nice holder. The swab is going to go inside your nostril to collect the sample for the test. It does not have to go in that far. In these directions, it says to insert it 1/2 inch. I'm going to use my ruler to measure 1/2 inch on the head of my swab. I'm going to mark it with my highlighter. That way I know how deep to put it inside my nostril. Now that the swab is prepared, you're ready to take your sample. You're going to insert the swab into one nostril and do slow circles around the edge of your nostril. Make sure that you insert it deep enough up into the point that you marked. Slowly move the swab in a circle as you insert it into your nostril. It may tickle a bit. Okay, now I'm going to switch to the other side and do another 5 slow circles. I'm going to put down my swab very carefully so it doesn't touch the table, and then I'm going to take the foil off my test tube. I'm going to put my swab inside the test tube immediately, and I'm going to set my timer for 30 seconds. While the timer is counting down, I'm going to slowly swirl my swab, pressing it against the sides of the tube until the 30 seconds are over. And you can use the clip to get a good hold on that swab. Okay, time's up. I'm going to take it out, and as I do so, I'm going to slowly squeeze the sides of the tube to try to get as much liquid out of the swab as possible, pressing it against the sides of the tube. Okay, that looks good. I'm just going to set my swab on this tissue, and then we're going to get ready to see the test results. Okay, almost done. Now we're going to squeeze a few drops of this onto our test strip. First, I'm going to close up this tube nice and tight to make a dropper. And then I'm going to prepare our test strip. It's probably going to be sealed in a package. Your test strip should have a well where you are going to put your liquid. Make sure you read your instructions to figure out how many drops and where to put them. On this test, there's a little spot on the bottom, and I'm going to put in 4 drops. I'm going to put this on the table, and then using my test tube, I'm going to use it like a dropper to put in 4 drops. Okay. Next is to set a timer for 15 minutes. Set your timer for 15 minutes or the amount of time indicated in your test kit instructions. We're going to wait the full 15 minutes before we check our test results. It's really important that you don't check your test results too early or too late, but the time that's given in your instructions. You can have your lollipop as a treat while you wait. When your timer goes off, that means it's time to look at your test results. Make sure to read your instructions that came with your kit to figure out how to read your test results. Every brand looks a little different. These instructions show below how to read your test results. What was your result? Negative.
Negative. Negative.
If your test is negative, that means there's a good chance that you do not have the COVID-19 virus. However, if you still feel sick, you should check with your doctor to see what you should do. You may need to go into the office to take another test. If your test is positive, that means that there's a good chance that you do have the COVID-19 virus. Please call your doctor and see what you should do to take care of yourself. You should also let your family, friends, and co-workers know so that they can take the proper steps to keep themselves safe and healthy. We hope that you find this adaptive kit helpful in taking a rapid home COVID-19 test. For more COVID-19 information and resources, please visit our website.
Thank you, Maya. At this time, we're going to turn this over to Daintree. Thank you, Daintree.
Hi, thank you so much, Holly. Great job, guys. Again, my name is Daintree Bartoldas. I'm the Executive Administrator for the Hawaii State Council on Developmental Disabilities. And here with me today is my coworker, Zosimo Arista, who's actually the acting Executive Administrator since I'm on vacation today. But what we wanted to talk to you guys about is let you know some of our initiatives. In March 2020, when COVID was coming out, our community and legislative liaison, Chase Selbert, got on it, and he was bringing us information from other areas, other states, as well as we are joining other agencies to see what we can do. Executive Office on Aging was a huge supporter. We got on to FEMA calls with them. Developmental Disabilities Division, under Mary Brogan's leadership, brought us in to make sure that we're all doing things the same way and supporting individuals with developmental disabilities. And then we found out that we really had a gap in our services of people who were not receiving Medicaid waiver services. And that's where Zosimo Arista has come in. He's the liaison for our self-advocacy agencies. And so what we wanted to do is make sure every individual with a developmental disability received informed, we're able to make an informed decision based on information that we are given to them, and making sure they had current and accurate information so they can make that informed decision. So we came up with a couple of initiatives, Why I Got My Shot, My Why, and also one, Kiki Tukapuna, as why individuals got their COVID vaccinations. So at this time, I'd like to send it over to Zosimo Arista, who'll tell you about those initiatives, and some of our advocates that helped us create messaging. Zosimo.
Hi, good afternoon. My name is Zosa Arista. I'm with the Hawaii State Council on Developmental Disabilities, and I'm joined today by self-advocate Bathy Fong and Ikaika Ka'ahanui with his mother, Amanda Ka'ahanui. And if they could turn on their videos. Thank you, Amanda. And Ikaika, are you there? Awesome, there's Ikaika. So today we're just going to be, Ikaika and Bathy, myself and Amanda are going to be covering the things that the self-advocates had done during the COVID pandemic, that we were able to provide help and services to people. So I'm going to share the screen and let's see. Hopefully put it into, there we go. So Bappy, can you read that for us?
Sure, Sosimo. Help people with disability during the COVID-19 pandemic. Sorry. How did the DD Council help people with disability during the COVID-19 pandemic? During the COVID-19 pandemic, the Hawaii State Council on Development Disability, Sosimo, can you help me read this part?
Provided protective masks,
mask, hand sanitizer, the vaccination support, and COVID-19 at home. Test to parents with disability and to
agencies
who services people with disability. Next slide.
So our self-advocates made videos to promote safe distancing during the pandemic. Let me turn on the sound there. Sorry.
Hi everyone, it's Renee and I'm demonstrating 6 feet apart. 6 feet apart is 2 arm lengths, just like this. Bye!
So that is Renee Manfredi and her father, and they're feeling safe, being safe, emergency preparedness trainers.
Hi everyone, it's Renee and I'm demonstrating 6 feet.
So the DD Council provided face masks to persons with disabilities and the larger community during the pandemic. And so these are some of the advocates, Ada, who volunteers in the DD Council office, and Kylie, as he's giving testimony at the state capitol, Vaipapa at her adult day program, and the DD Council staff at the Best Buddies Walk. The self-advocates also made videos for pandemic safety measures, talking about wearing masks for protection.
Aloha, Renee Manfredi, Health Messenger for Special Olympics Hawaii. The governor has recommended that we wear face masks or cloth face coverings when we are out. A cloth mask, like this one, made by my friend Jamie, can help decrease the spread of COVID-19. When we wear face masks, we can help protect each other from the germs that cause the virus. Of course, the best thing that we can do is just stay at home. But if we have to go out, remember, stay 6 feet apart and wear a mask. Aloha!
So that's our Renee Manfredi again, doing a video on wearing masks.
Aloha.
The DD Council also provided hand sanitizers to local nonprofit agencies statewide to support COVID-19 health practices. So the self-advocates also made videos on how to use hand sanitizers.
2, 1, Kylie.
Warning, there are some caution you must take when using hand sanitizer. Using hand sanitizer is okay, but only should be used when you're leaving the store or exit the bus. Number 1, apply a quart-sized amount of hand sanitizer. Number 2, rub the drops over your hands, even your thumb, pinky, and fingernails. Number 3, keep rubbing for the drops for 20 seconds and you're done. Lots of people ask if using hand sanitizer is better than washing your hands. No, it does not. In fact, there are 2 things people should not use hand sanitizer for. 1, do not use if their hands are dirty or greasy. 2, hand sanitizer can be dangerous and can affect your skin. For example, one person used hand sanitizer and he got shocked when he touched something metal. His hand also caught on fire. Luckily, he was able to find a sink. He was able to put out the fire. After that incident happened, they put warning sign that says flammable on all sanitizers. Thank you.
So that was Kylie Swan narrating this video with Renee Manfredi, Patrick McGoldrick, Timothy Rankin, and Bathy Fong. And they're all feeling safe, being safe, emergency preparedness trainers.
2,
On Kauai, the self-advocates helped with food distribution. Earlier, Daintree was talking about self-advocates, why they got their vaccination shots. This is Jensen Arakaki, and the number one reason he wanted to get his vaccination shot was that he could go back to his day program in person. He missed going out with his friends in the community. He talked about Special Olympics, gathering together, and thanking Easter Seals and the DOHDD division for helping him get his vaccine. So he made this little information sheet. Here's Rel Romero. She's another self-advocate, and she missed spending time with her friends and wanting to meet in person. She also is part of Special Olympics called the team called the Terminators. So she definitely wanted to go back to that. And so she also wanted to thank the Developmental Disabilities Division for helping her to get her shot. This is Ian Nibles, and he has a job and he wanted to keep his customers and coworkers safe at his job. He also catches the bus, so he wanted to make sure that people on the bus and he were safe and that he wouldn't affect people. So he also wanted to thank the Developmental Disabilities Division. And here's our Bathy Fong. And Bathy, did you want to talk about your reason why you got your vaccine?
So the reason why I got my vaccine because I wanted to be safe in the community, and also I took this picture to show everyone I took my vaccine at home. So they came to my house and take my vaccine for free.
Awesome.
Yeah, and then I'm actually gonna take my second booster on Friday. They're gonna come to my house again and take my booster. So I am very excited for that.
Awesome. Thank you, Bathy.
You're welcome.
The Ka'ahanui made a video, and I'm going to pass it over to Amanda, and she can talk about the reason why she and her family made this video. Amanda?
Hi, aloha everyone. My name is Amanda Ka'ahanui. I'm Ikaika's mom, and our family is made up of Kapuna, my husband, and myself, and Ikaika, the person with a disability. And so we wanted to help share why it's important for folks to get their vaccine so that our whole community can be safe. Ikaika wants to be a filmmaker, and so he wrote the script, he filmed it, he edited it, and then he captioned it. So that was why we made it, so that we could help other people understand why the vaccines are important and hopefully share our stories.
Awesome. Ikaika, is there anything that you wanted to talk about that made the film that you made for the vaccine?
Can you repeat that question, please?
Ikaika, he just wants to know if you have anything to share about the video that you made for your vaccine video.
My what?
The vaccine video that you made, is there anything you
Yeah.
want to share with people?
Yeah.
Why is the vaccine important to you, Ikaika?
So that vaccine is important because it prevents us from getting COVID.
Awesome. Thank you, Amanda. Thank you, Ikaika.
Welcome.
Let me pull up the video that they made.
Aloha! We are the Ka'anui Ohana.
And we live on the windward side of Oahu.
And we are fully vaccinated.
I was the first one to get the vaccine in March.
I got mine second in April.
And I am the third one to get one in May. I got the Pfizer type because I'm 70 years old.
From what we've learned about the vaccine, it's safe and effective with minimal side effects, and it's available to a wide range of people. Living with a keiki with a disability and a husband who's considered kapuna, I got my vaccine to protect them.
I got the vaccine basically because I did not want to die, and as well as my family. I didn't want them to die.
The reason why I got the vaccine because I want to stay healthy and go back to school.
Well, if the majority of people are vaccinated, hopefully we can have some semblance of normalcy of us going to the store, the theater, like it was before the pandemic. I feel great. I feel I've helped my family as well as the community.
I feel great. No major side effects, and I feel like I'm part of the solution.
I feel like a new person and I feel safer on others.
Watch this.
How to get the sweetest deals online when
Okay, that was a wonderful video that the Ka'ahanui family put together. It was awesome. And let's go back. So the DD Council also provided vaccine incentive cards to the community on Lanai. And if they receive their vaccine at the healthcare center or at the local hospital, they would receive a $10 gift card from a local participating merchant. There were various gift cards from different businesses. So it helped the businesses to generate income, and it also helped to keep the community safe from the COVID infection. Here's our self-advocate, Michelle Moral, who's learning how to use a COVID-19 test. And Tim Rankin, he's our self-advocate, the self-advocate vice president, also doing a COVID-19 test called IntelliSwab.
Good morning. This is Kylie Swan. He's a self-advocate, and he's going to use the iHealth COVID-19 at-home self-test kit. Okay.
Timothy also participated in the emergency preparedness fair at the Windward Mall to help promote safety. And he was met by Representative Matayoshi and Councilwoman Kia Aina. We wanted to thank you for allowing us to present how the DD Council and the Self-Advocacy Advisory Council responded to the COVID-19. Back to you. Thank you, Bathy. Thank you, Amanda. Thank you, Ikaika.
Bye, everyone. I gotta go right now because I'm actually in school. Thank you for inviting me. Yeah. Bye.
Bye.
Okay, take care.
Okay, I just want to say thank you again to our amazing panelists. There was just so much information shared today. We're really grateful for all of that you do. And also it was such a joy seeing all of the videos that you, Maya, and also the self-advocates have created. I haven't seen a lot of them. And so seeing all of the COVID related things that you folks are creating and doing for your community was really great. We do have some time for some questions. Let me start off. Let's see. This is related to kind of the social stories. And so we're just curious to see if the CDS develop other kinds of social stories, and where can people download the social stories?
That's a great question. So we developed social stories specific to receiving a vaccination. However, there are social stories available for all sorts of different medical situations, social situations, school, hygiene tasks, etc. And so if there is a particular situation that you have in mind, feel free to just Google social stories and then whatever topic it is, such as social stories taking the bus or social stories going to the doctor. A lot of hospitals also provide customized social stories where they actually have pictures of the parking lot, the entrance, the doctor's offices, and so on. So you can feel more comfortable if you're going to a new place. And that's something that you can ask for ahead of time. And the social stories that we developed, you can find on our website, and Sai has posted the link in the Q&A. And so at our resource website, you can download the social stories that we developed. And we also have a few that have been developed by other agencies and entities in the US, such as the CDC or other hospitals that are maybe more in depth about a vaccination experience as well.
Thank you, Maya. Yes, I know when I saw those social stories, all I could think of was our CBOs who do a lot of community events, and oftentimes they do have children and just a wide variety of people that's coming up to their events. And so I think that would be a really great resource to have on hand for them. Let's see, another question. Are the adaptive kits still available? I think it was mentioned in the video that we would just have to contact you folks if anyone's interested in receiving them.
Yes, we have so many available. So if anyone would like some for themselves or to distribute, please reach out to us. We're happy to distribute large quantities to organizations for dissemination to the community. We also have we have a ton of supplies that haven't been assembled. So if you are part of an organization with self-advocates and you're looking for a fun activity, we would love some help from self-advocates in the community assembling those kits. So please let us know if that's something that volunteers might be interested in helping with.
Thanks, Maya. That's really great to know. Let me see. Oh, I think I'm personally curious, are the self-advocates still creating videos that's related to COVID? I saw that you guys covered such a wide array of topics and that really touched on important topics. I'm curious if you folks are still creating videos and doing that and sharing it with folks.
Right now, the self-advocates have not recorded since the last video that was produced. But if there's a need, then the self-advocates definitely will provide a video on whatever topic that people are interested in, and that can be done here in our office.
Thank you, Zosimo.
Eka is also available to make a video if you guys need something from him as well.
Oh, perfect. Yes, hoping for partnerships in the future. Let's see. And one final question. I know you folks covered a lot in your presentations, but are there other tips or recommendations that you folks would offer to, say, community organizations when they're planning their VAX events, but they're not necessarily geared towards people with disabilities?
We would really strongly encourage outreach to our self-advocates to be there, to be a part of the planning at the table, because we want it inclusive. So we don't need special events just for people with disabilities. It's for everybody. And by having us at the table, individuals with developmental disabilities, just to let them know some tricks that we could do that could help be more inclusive, that's why we like to be invited. So it's very important to have our self-advocates at the table.
And just to add on to that, we are also very happy at CDS to assist with planning as well as staff training. So that's something that we've offered to people in terms of vaccine providers or other event organizers. If you are interested in having, a mini Zoom training, that's something that we would be happy to do as well.
And to add on to that, partnership is everything. So if you are representing an organization, just reach out. Our contact information, we'll make sure that that is in the Q&A because we would love to certainly just get in the conversation, help support you about your needs and the events that you're looking to host, and really helping to just have this statewide response. That's what we're really saying, right? This work needs to be across agencies, university partners, self-advocates. It is necessary to have this statewide response. So thank you so much for all of the community partners that have already been participating. And if you haven't yet, we know that there's plenty of work to continue to do in this area to make sure that these are inclusive and accessible.
Thank you so much. Again, thank you, folks. We will have a mahalo message to send to everyone who's joined us today. And we'll make sure to include all of your contact information, the links of resources, and as well as the videos that you folks shared. So we are reaching our 1 o'clock mark. So I want to thank you, Daintree, Holly, Maya, Sai, Zosimo, and of course, our two self-advocates, Ikaika and Bathi, for joining us today. We are really grateful for your time and sharing with us all your expertise and resources. And we really hope that starting from now, we have more partnerships down the road. Thank you to everyone on Zoom for joining us. And lastly, I want to thank our Hi-Fi team who's on the behind the scenes making this happen. Be safe and be well, everyone, and have a great rest of your week.
Thank you for the opportunity. Thank you, everybody.